Estás viendo Canal América, televisión dominicana para el mundo.
Time for True Show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. I'm your host, Dr. Bernard Fialkoff, and it's always a pleasure to have you with us. And we're right into 2023, making a really beautiful year with all our resolutions. We've gone through so much in the last few years with all the stresses, the COVID, the social distancing, and so much emotional stress, economic stress, apathy, grief, loss of loved ones. But out of that also has come out some very interesting findings, which are very positive, which are innovative, and which clear the light on some factors that some people suspected, some people said no, that had nothing to do with anything. And we're talking about stress and emotions and a person's mental outlook, their viewpoint. Not genetic, but their emotions. What we call in science phenotype, how the person is affected by the environment. And not genotype, which how the person is affected by their genes and their chromosomes. And obviously both have effects. But what's interesting is this unfortunate last few years led to a lot of discoveries. And one of those is that stress, emotional levels which are very low, such as apathy, grief, anxiety, fear, have been shown to lead to diabetes, to lead to other diseases and other infirmities, things that some health practitioners have suspected for so long, and something that was called the general adaptation syndrome when I trained as a surgeon back in 1981, 82, and was researching it because I saw some of my patients didn't heal the same, even though I did the same procedure. The people who were a little more well off emotionally, or more sound of mind, or a better life, seem to do better and have less pain than the others, which had a difficult life, troubled life. And so now the scientific findings are bearing this out. And so this show will be dedicated to you, so that you can make sure that in your life you minimize your stresses, not just from the mental standpoint, but from the physical standpoint of what happens in your body, and you to be able to enjoy your life and live a long, healthy life and enjoy your family and friends. So engineer, let's put up the first slide, and we'll start giving you some scientific results. And here you see one from familydoctor.org. Poor emotional health can weaken your body's immune system. Obviously, the immune system is so involved in so many different diseases and in illness prevention. This obviously makes you more susceptible to something we've all known for years, is stress and colds, stress and the flu, but also other infections now, we know this, especially during emotional difficult times like we've had with COVID. So when you're feeling stressed, whether it be at your house, at your job, wherever you may be, or you're anxious, or you're upset, or you have a fight with your spouse or your friend. Now we're starting to see that these things actually affect your health. Let's go to the next slide. So engineer, if we can go to the next slide, please. And here we go. This one is from the Mayo Clinic. And the Mayo Clinic, with one of the physicians of that entity, very well-known organization. And here, a book that this doctor wrote, The Feeling Being. What is a feeling being? Well, a feeling being is a being that is a human being, because a human being perceives. We have emotions. When we walk into the room, many times we sense things, even though we don't physically see them. Even though the people in the room may try to make it seem like something else occurred, yet we feel it. Globally, when we had 9/11, there was a global apathy, a global darkness that came over the world because there are global perceptions. And we communicate through the media, but it wasn't just the electronic media we were feeling. It was the loss, the emotional loss. That loss led to some anguish. You could call it even mental pain. And now we see from the Mayo Clinic proceedings that we do feel that it's not something illusionary or fictitious or imaginary or somebody's, delusion. Let's go to the next slide. So here we have a study that was done at my alma mater, the State University of New York at Stony Brook Medical School. And what they found, that stress and social supports are important influences in a man's risk for developing prostate cancer. Obviously, there's been so many men who unfortunately died. My own father died of prostate cancer. And I really, when he was going through this years earlier, I felt that he had gone through a lot of stress in different factors of his life. Being his son, I was very well aware of that. But there were no studies back then. It was just my feeling, my intuitiveness as a human being. And at Stony Brook, what they found is that men with high level of stress and lack of satisfying relationships with family, with friends, had actually higher levels of the PSA antigen test that all males take when they get into their 40s, 50s, 60s, 70s, because we worry about prostate enlargement, prostate cancer, and obviously having a life that we can live without pain, without surgery, without radiation. So this was a very important finding at Stony Brook because it leads to a way of prevention that is very interesting that maybe wasn't looked at before. Let's go to the next slide and more of this study from Stony Brook with what they found. And what they said is that based on the scientific results, the risk of having an abnormal PSA was 3 times higher for men with higher levels of stress. What is stress? Well, obviously, if you have people angry at you, or if you're anxious, or you yourself are angry, or you're in apathy, or you've lost many things, or you're very anxious about something at your job, or it's very difficult for you to confront. These are all different types of stress. Likewise, men who had felt they had low levels of support from friends and family were twice as likely to have an abnormal PSA. Very, very interesting, because over the years, I had read and others had spoken to me about how it seemed that the man-woman relationship, the sexual relationship, and was also in the family with the rearing of children, seemed to somehow be involved in cancer, and that somehow this stress and this very creative family dynamic and partner dynamic of a man and a woman creating life, it seemed that stress on that creativity caused the creativity to go south, that led to death, destruction, cancer, like a negative creativity, which was happening with the stress, with the arguments, which was ever going on. Very interesting. those are actually things that we need to take a look at, because the findings have raised possibility that a man's psychological state, and we could say, well, if this is men, we could take a look at possibly studies with breast cancer for women, which need to be done, because what are the impacts that this would have? How would this change a person's ability to survive cancer, and number two, to avoid it in the first place? Engineer, please, the next slide. Here we have from the Malaysian Medical Journal, and this a life event, stress in illness by Muho Rosali and Salih. And in the abstract of this article, again dealing with these different stress factors and illnesses, infirmities, the relationship between stress and illness they felt was complex, and the susceptibility to the stress varied from person to person. Amongst the factors that influenced the susceptibility to stress were genetic vulnerabilities, were coping style. Coping style, well, family relationships, communication, how you deal, handling things, completing things, or incomplete factors, incomplete jobs, the stresses that come from that, and the type of personality, again, is a personality type, a stress personality. Are they under stress? Why are they stress personality? What kind of upbringing do they have? This brings in very interesting ramifications and factors that we need to take a look at, starting with our children at a very early age, how we raise them, and how that affects their personality type. And the social support that we give one another that we see during COVID was really absent, because we had to social distance, we took all these precautions, but what was absent was that human communication, the human bond. And you know, so much has been said about love and how it dissolves upsets and hates. And Martin Luther King had said how love is the road to resolving man's hates, man's prejudices. Very interesting now that science is finding that it's not just a social, it's not just a spiritual, it's not just a philosophical idea, but that we're actually starting to see how the human being really is a spiritual being, has a physical entity, and has a mind. And that all these factors are interacting to cause what we're seeing, which actually would make sense. Let's go to the next slide. Here on this slide, we have one from the Harvard Medical School, and they publish in the Harvard Health. They have a journal online, and their blog, Autoimmune Disease and Stress. Is there a link by Dr. Robert Schmerling, MD? And this is a study at Harvard. An engineer, if we go to the actual study, I want to quote you from that study so that you can see what was written and the result of that study in this next slide that we're going to be putting up. So if we get that slide up now, engineer, and I will present, there we go. And there you see, this was on autoimmune disease. What is autoimmune disease? Autoimmune disease are diseases where your immune system actually attacks your own body. And you say, my God, how can that be? And it's interesting now that emotions, negative emotions, because obviously positive emotions are not going to give you stress, they're going to alleviate the stress. But negative emotions, when we get angry and we just want to break something, right? Or we want to push something out of the way, and it seems like it's not only just negative, but there's a little bit of destructivity to it. And it's interesting to find that autoimmune disease in this study from Harvard was correlated now with stress, because if you look at stress in that way, that destructive process in different ramifications, maybe at first the person themselves being destructive in anger, maybe in fear being more the effect of that, being the effect, the anxiety, the terror of maybe a situation that the person can't confront. But in this study, the interesting thing, in this new study, it raised the possibility that stress may cause autoimmune disease. Very interesting. What are autoimmune diseases? Some are called lupus, or some are called rheumatoid arthritis. In my office, I happen to have many patients that unfortunately suffer from rheumatoid arthritis. And over the years, the joints in their hands and their limbs it really gets really a horrible state. And it's really a sad condition that they get in. But to have this possibility that they could decrease their stress and maybe reduce their autoimmune disease, or if they start early enough when they know they maybe have a familial genetic predisposition in that family and they decrease their stress levels initially, that other factors could enter in to decrease that person's, proclivity to having the rheumatoid arthritis, the lupus, to needing steroids. Because now when we need to treat them, as I know as a surgeon, we have to be careful. We have to give them different antibiotics. We have to control the steroids, the autoimmune suppressing drugs. And these autoimmune suppressing drugs lead to other changes in the body. So they're not innocuous. They're not things that are just very easy to take without other ramifications of taking those drugs. So it's very interesting and kind of funny, but in this study and the patients that participated, when the results came out, the patients said, "I knew it." And so many of us have suspected it. Many of my health colleagues always talk about it when we get together our study clubs. So let's take a look at this now, because now we've looked at all this science, recent findings, and what came out of this disastrous 2 years of stress. The fact that drug use increased almost 50%, that alcohol use almost increased 50% globally. So obviously, these people, these inhabitants of all the nations were under stress. They were looking for a solution. And unfortunately, a drug and alcohol solution would also increase more physical ramifications, more disease proclivity, more illness, and other ramifications of suicide, obviously. But let's stick today with just the illness. And let's take a look now at something that we could apply other than saying, well, we're going to take a vacation. Because when we come back, we're back in the same soup. We're back in the same boiling kettle. We haven't changed our stress. We've minimized it for a period of time. So, taking a vacation is great, but it's not really long term. We all have to work, we have to produce, we have to pay for our mortgages, for electric bill, for food, the grocery store, the lease payments, the insurance payments. That's life. But what can we do then? Well, one of the things is we could go for a walk. Seems like something too simple to say, but going for a walk about a half an hour at least, and getting out in the environment, looking around, maybe going a walk with your spouse or your friend, and just relaxing. Obviously, going to the gym and getting out your frustrations. So whatever energy has been cycling in your body, you get out, you put it out into the weights, into the yoga, into the stretching, into the different kinds of exercise. Very well known for many years that walking, that exercise, that getting a good night's sleep so your cortisol levels go down, so you don't gain weight, so you don't start affecting your blood sugar levels, so you don't feel uncomfortable in your clothing, so that you feel comfortable during the day, because if you feel uncomfortable and you're already stressed to begin with, now you're more uncomfortable, you have more stress, your cortisol level goes even higher. Maybe now you start affecting other factors in your body and you get disease. So it's very interesting what's been going on. Now we have a video that I'm going to show you, and something that I was exposed to back in 1989 through a friend of mine who was a doctor, and he had found it himself, and he said, why don't you try this out? I looked at it and it seemed to work. So it's something that I found, and I researched into it because as a doctor, I'm very skeptical of things. When implants first came out, dental implants, I didn't believe them, because when I trained, they were different kind of implants, and those failed 50% of the time. But in Sweden, back in the 80s, they found a different kind of implant, and now they're about 95, 99% successful, and it revolutionized the field of implant dentistry. But when the Swedes came to the United States, we ridiculed it. We said it was impossible. We would never use it in the United States. And lo and behold, not only in the United States, and every dentist is clamoring and doing implants in their practices, but globally, now people are getting their teeth back, getting their smiles back, because we have dental implants at a high level. So now I'm going to present something to you that, again, is very innovative, insightful, and we're going to show you in this video to give you an idea of something that you could do. It's not the only way, but it's a way that you could look into, and if you find that it would work for you, you could try. So engineer, let's put on this video of Dianetics, which was developed by engineer, mathematician, musician, writer, explorer, pilot, musician. Really, the man did so many things. It's really, I could go on and on. But let's take a look at this Dianetic technology of the mind on reducing stress, anxiety, negative emotions. Let's take a look.
Do you know someone who has never fully recovered from a serious loss in life? Or a traumatic experience? And in your own day-to-day life, do you sometimes experience self-doubts, negative thoughts, unreasonable fears, upsets, or irrational behavior? The painful experiences of our past clearly have an effect upon our present behavior. But to what degree and why? What causes the mind to depart from rational thought or behavior? That is the subject of Dianetics. Every moment of your life, your mind is recording everything that's happening to you. Every sight, every sound, every taste, smell, pain, emotion, touch, everything. These recordings form what is called the time track, a consecutive record of all the experiences accumulated throughout your existence. Your mind uses this information to make decisions and solve problems relating to your survival. The better its decisions, the better you survive. Most of this data is stored in your analytical mind, that part of your mind that thinks, remembers, and calculates. But some of your experiences are not recorded into those analytical memory banks. It is a discovery of Dianetics that all of your painful experiences are stored in a previously unknown part of the mind. It's called the reactive mind, and it throws those experiences back at you in an irrational attempt to get you to avoid the same painful thing from happening to you again. Here's a simple and common example. At some point, you've probably gotten sick from eating tainted food. Later in life, if you see or smell or possibly even think about that particular food again, you start to feel a little nauseous. Now, you know that logically, the mere sight or smell or thought of a food can't physically make your body ill, because you haven't actually eaten it again. And yet you're experiencing the same sick feeling you had before. This is your reactive mind, making you re-experience the same perceptions it recorded in that earlier incident, in a crude attempt to protect you from what it believes is a dangerous situation. It reacts solely on a stimulus-response basis and below your awareness. The painful experiences hidden in your reactive mind are the cause of your fears, insecurities, negative thoughts, unwanted emotions, and irrational behavior. You have been accumulating these deeply buried experiences throughout your existence. In fact, the most damaging among them occurred before you were born. Dianetics reveals how these negative experiences are stored and contains a technology to free yourself from them. What would life be like if all of the pain you've experienced no longer affected your abilities, emotions, and behavior? You would think and behave rationally, making the best possible decisions relating to your survival. You would be able to utilize your imagination and creativity to their fullest. You would be confident, more intelligent and productive and happier. You would be yourself, free to enjoy life and reach your full potential. In short, your mind would be clear. That is the goal of Dianetics. People achieve this state every day, and so can you.
So there you go. And there is a technology that you could utilize to decrease emotions that are negative, to see where your stress is coming from. Because, to tell someone that they have stress and tell them that they need to take a vacation, what solution have you given them? They still feel an effect. They don't really feel like they're in control of their lives. And really putting them back in control of their lives would really do tremendous amount for that stress. So how many times have, people told you, well, you have to decrease your stress, or, go to sleep earlier, but they don't tell you how. And you have to have actually productive ways. So I want to expose you to that because it's something that I was exposed to back in 1989. And to my surprise, when I applied it with other people, it actually worked. And to me, that was the proof that I needed, because to have a philosophy of life is okay, it's fine. We all have philosophies. We're all entitled to have our philosophies. But as a doctor, as a surgeon, what I always look for is not a philosophy, not the latest marketing technique, but something that was going to really work on my patients. And so for me and my family, with my friends, when I was introduced to this, I found that the stress levels really did go down. I was amazed, because I, probably like you, had thought that, well, this is the way I am, or this is the way my family is. Maybe it's something genetic, and it's always going to be that way. And so that's kind of like, a way of never being able to really change something. But now with this technology, it's really possible to really take a look and delve into it and, change your stress levels. Because now we're seeing that all the scientific results coming in are showing this. So now, let's go over what you can do. You can take a walk. You can get exercise. You can do yoga. You can go and do something fun with your friends. Listen to some music. Create something. Arts and crafts. You can paint something. You can write some poetry. You can go, out and do something. You make your job more efficient. Resolve a problem with your coworkers. And now you have this Dianetics, which is something that if you felt, well, that's the way I am, but you've always wanted to change it, and you felt like it was never going to be, that was going to be the way for the rest of your life. Now you have that also. And I hope that you find this show and what we've gone over useful to you, that you're able to decrease your stress levels, that you're able to decrease your illness, your infirmity, that you're able to increase your control, your productivity, your happiness, and your joy. Because really, when you look at it, sooner or later, we're all going to die. But while we're here on this journey, let's enjoy it. Let's do the best that we can. Let's work together. And let's create a stress-decreased world. I'm not going to say stress-free world, but a stress-less world, and a happy world, and a world where we get along. I hope it's been very useful for you. And then 2023, this allows you to achieve your resolutions. And you find that you can stop smoking. And you can lose weight because your stress levels go down and your cortisol level goes down. And you find that partner that you always wanted to find because you're more appealing now, because you're more positive. Have a great night. And we'll see you again on the next Time for Truth show. Be well.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got. But the world takes you down. You just keep moving on. Let your feet